Hi, everybody. My name is Natalie Yeadon, and I'm the co-owner and CEO of Impetus Digital. At Impetus Digital, we have built some of the best-in-class asynchronous and synchronous virtual collaboration and communication tools for life science companies that we work with across the globe over the last 12 years. We've actually helped people from helping them virtualize everything from advisory boards to medical education meetings, various types of publication groups, investigator meetings, large corporate events. We just launched something called Insight Events, and everything in between. But more importantly, at Impetus, we really believe that everything starts with a conversation. And from these big, hairy, audacious, cool, awesome conversations with some of the leading edge thinkers, digital entrepreneurs, provocateurs, we can all work to collectively and positively disrupt healthcare. So we also believe that with that conversation that we need to do things to sustain it. We need to build partnerships. We need to use asynchronous and synchronous virtual tools and platforms to continue to build the momentum around great ideas. I'm really thrilled to have one of these great thinkers at the table today, and this is Jeannie Chen. Jeannie Chen is the head of clinical operations and people at a company called Hazel Health. It's a company dedicated to improving the health and well-being of children by increasing access to really high quality healthcare. In addition to providing great leadership to the clinical and corporate teams at Hazel, Jeannie serves in account management and implementation roles for the school districts utilizing Hazel Health today. Jeannie has almost 2 decades of fantastic executive level healthcare strategy experience in both delivery as well as in clinical quality capacities. She's also really passionate about mental health and making really solid interventions early in a child's life, and really looking forward to digging into that today. She received her undergraduate degree from Duke University and her MBA from the Wharton School at the University of Pennsylvania. Welcome, Jeannie. So happy to have you on the show today.
Hi, Natalie. Thank you so much for the warm welcome. I'm so excited to be here today with you all.
Absolutely. We're always intrigued, by the way, by other great women leaders, women who have paraded a career in a really successful career trajectory in STEM, in the science, technology, mathematics, engineering, and also in the arts. So we're now calling it STEAM. So always really inspired by women leaders. Tell us a little bit about what got you into this fantastic company and in the role that you run right now with the clinical operations and people.
Thanks, Natalie. So I just have fallen in love with the world of clinical operations. So as you had mentioned, my entire career has been in healthcare, mainly in strategy roles, kind of initially right out of school, but I love kind of the connection between delivering high quality care in a really consistent, competent, and caring way. And so I found my heart in clinical operations. My last company that I was at was really focused on behavioral health. And we worked with mainly young women that, their parents just didn't feel like they could keep them safe anymore. So they would come live in our programs, get 24-hour care and treatment. And it was just beautiful work. And I'm sure, as you and your listeners know, that trauma generally is generational. And so one of our focuses was to heal generations. And I really believe that the company that I was with was able to do that. The thing I personally struggled with was our programs were generally $80,000, $100,000 a year. And so going back to access, very few people would be able to take advantage of the wonderful care that we were able to deliver. And so that kind of led me to Hazel and learning more about it, and really believe in our belief that all students deserve high quality healthcare. Everyone deserves high quality healthcare, and focusing on bringing that access into increasing equity. And I think about the young women that we worked with, and I know, had we been able to intervene earlier with something like Hazel, they just would have been in a very, very different trajectory.
I love it. Tell us, if you were able to now have some of those young women that you were working with get involved with Hazel Health, how do you think that would have changed the course of their health and maybe some of the other decisions that they've made in their life? What do you think would have been that inflection point, or that change of what the services or products that you were providing to them?
Yeah, it's a great question, Natalie. I think, first and foremost, a lot of kind of mental health, behavioral health, kind of struggles really stem and sometimes are shown through physical health. And so I think that's one of the amazing things that we're able to do at Hazel is to connect with our students at a level of, maybe that stomach ache or headache. 33% of them generally are from a mental health or behavioral health underlying issue that maybe just hasn't been uncovered yet. And so, they could come into our health office and talk to one of our amazing school nurses and starting a visit and just starting that relationship, I think, and, giving them space to have the conversations, and we can assess and screen the severity and really help them get into some of the resources and even tapping back into the school, some of the wraparound resources that they have at school as well.
So with Hazel Health, it's obviously in play because there's a healthcare need or a gap. You were mentioning a few things around access, et cetera, about kind and empathetic delivery of care. But what else is missing currently as we talk about specifically the population that Hazel Health is targeting?
Yeah, it's a great question, Natalie. One of the amazing things that we have here is that at Hazel is recognizing that the healthcare system that we're delivering is broken. And so I think that's one of the first and foremost things. The founders that came together were bringing in, amazing technology, caring, quality, high quality healthcare, and the education space. And so coming together to try to fix this broken problem, we all kind of came together. And so the thing that I think that we're trying to fill is there are gaps in care. 40% of our students say that they don't have a primary care physician or someone that gives a continuity of care. And we absolutely believe in the medical home. And we believe that we are connecting the students in a really non-traditional way where they are. So either at school for the most part, or even at home, and connecting them back into the healthcare world. Sometimes, quite honestly, we can have conversations and say, hey, we really do think that you need to find a local PCP. And they might have heard it before, but having that connection and building upon the trust that the school districts have already established with their families and saying, hey, let us help you. My parents came over to the US as immigrants. I never had a medical home growing up. I think it's an amazing thing, a wonderful thing that every single child deserves. And I know firsthand that the US healthcare system is really complex and confusing. My parents did the best they could, but I definitely didn't have a doctor that knew me for, my entire life. And so we believe that here at Hazel, we're helping fill that gap. So we're there when there's a need, and helping them link back into the more traditional system.
So you are obviously filling a very important need, which is this whole like longitudinal review or view on a person and their wellness through over time. So that obviously is a huge gap. I'm just curious about what tools and services Hazel Health utilizes in order to bridge that gap. And what makes Hazel different from all the other entities and organizations that are similar to you?
That's a great question, Natalie. I think first and foremost, our entire service and platform is really based on serving kids at school and in partnership with school districts. So we really understand the differences between FERPA and HIPAA and what situations are, is there a legitimate education reason that we can actually, disclose something to the school and work together and help that family. We also really understand some of just cultural competency, like things like immigration and worried about tapping into kind of like a public charge, for example. And so, making that connection with families and just understanding where they're at and helping them take that next step. From a technology standpoint, we have just amazing engineers. I have to say, living and working in more traditional healthcare arenas, where we would call it IT, and just really struggled with, the technology platform. And our engineers come from places like Google and Apple, and just have redesigned everything to be centered around the student, and around the provider. And so some of the questions that they'll always ask us would be like, well, why is it that way? Why does it have to be that way? And so sometimes it's like, well, it's always been that way. I remember our chief technology officer had the conversation very early on and said, why do we actually need to have a chart? I was like, what do you mean? And of course, I mean, we do have an EMR and a charting system, but the way that it's been created is much more of a natural flow of the conversations that we have. And also it's the information that the providers need at the time that they need it. And so some of the connection points as well is, being able to have the provider that had met with the student beforehand, made a connection, having a preferred provider, for example, they've already kind of know the history, but also we're able to capture it. So if someone does happen to pick up, they're able to get as much information as possible.
So really just good, solid use of technology for documentation, and then making sure that there's an evolution or a continual discourse with the other caregivers who may be, or healthcare providers who may be part of that ecosystem as well. Which brings me to my next question, Jeannie. So creating this ecosystem of healthcare providers, probably in a series of different functional roles. I'm sure there's, very specific therapeutic sites or areas or conditions that you would need to get that level of specialization. Do you have a standard roster? I'm just curious, if physicians were interested in Hazel Health, how do they get involved? Who do they contact? And is there sort of a level, like a maximum number of these sort of specialists that you deal with, just to kind of keep some consistency in the user experience?
Yeah, it's a great question, Natalie. I think, so to answer your question, we're always looking for amazing, competent, and caring providers. And so we have kind of an unusual interviewing process, I'll just say. And so it is multi-step. We are looking at for different things. And I think one of the things that that makes us most unique is that we are looking to see, can you make that connection over this platform? And it's very different. And also understanding and knowing whether or not a student can actually make that connection. We've actually pulled in doing like a live interview with a student to say, people can connect from an adult level, and the platform, sometimes you're talking directly to the student. So it's really important that you can get the information that you need and make the right clinical decision moving forward.
So you were saying that obviously one of your core differentiators is that you've targeted school systems up front. They're kind of your major target market. How did you go in and build that relationship and in that awareness? And how did you become the go-to healthcare liaison technology tool of choice? How did you build that relationship?
I think with a lot of humbleness, I'll just admit, really leveraging just the expertise that the schools have had, and taking responsibility for the trust that they've built with their families. And so working side by side with school nurses, sitting in their offices, understanding just the immense pressure that they have, the number of students that are coming in, the number of needs that they're having, and trying to really understand how can Hazel help them? How can it fit into their flow? So it's a natural benefit, not only for the student, but also for the school nurses and families, and the rest of the staff as well.
So is this more of an awareness campaign? And if you're doing marketing or targeting, is this really towards the higher level, like school system, and then it gets disseminated and they get educated on this tool? Or do you go directly to the nurses who say, I have this really, so is it organic that way and then it grows upwards, or was it sort of top down?
We've done both. We've definitely have gone and worked with school nurses that have brought us into the districts and said, this is an amazing platform, especially quite honestly in the COVID world, and giving them additional support. It's also gone from the other way, where we've had conversations with superintendents that have said, I want something like this for my district, and pulling in the rest of their leadership and healthcare leadership in that way as well. It's also come in from parents. And so a neighboring district could hear about, wow, that is really phenomenal. And how can I pull something like that for our district as well?
Excellent. And I guess in that model, how somebody has to pay for the platform or for the service and the tools. Where is that money coming from? Is it coming from the school districts? Is it coming from the government? How do people get access to this, and do they have to pay?
It's a great question, Natalie. I would say we have a couple different models. It depends on the state. And so we have some models that health plans are majority paying. We have some that the school districts are also contributing. We want to make sure that the platform everyone has access to it. So we also have a financial aid program that people can apply for if they don't have insurance, and they're unable to pay. That we also have financial aid qualification as well.
Right, that's awesome to hear that. So let's actually think about the way the world was prior to COVID.
Yeah.
What were some of the ways that students and specific students were brought to the attention or were brought to the platform? How did they find it? Was it a teacher that had noticed some specific changes with a student and then they went ahead and referred? Was it a parent? What was going on, and what were the kinds of typical students that were coming in before COVID?
Yeah, it's a great question, Natalie. I would say all the above. It definitely, I think one of the most powerful things was teaching a student to advocate for themselves. And I love the students that, we would ask, hey, how did you come down here? And some would say, I raised my hand and, I heard about Hazel and I wanted to come down. There were also times that the nurse actually would say, gosh, you really need to see Hazel. I can think of a time where it was towards the end of the year, final exams were happening, and a student came in that had obvious pink eye. And so they didn't even step into the classroom. The administrator noticed it right after the student walked off the bus, and she went directly to the health office. The nurse basically called the mom and said, hey, your student likely has some kind of conjunctivitis. You need to pick up your student. And the mom just said, I know. And she said, I know it's final exams. I don't want her to fail her classes. I don't want her to have to do summer school. And I didn't know what to do. I called, she had a PCP. She said the PCP said we can get her in about 30 days, which is sometimes common if you have Medicaid. And she asked, well, what can I do? And they said, you could go to the emergency room. And that's just not something, she wanted to do at the time. So she sent her to school, crossed her fingers, and just said, we'll see what happens. And the nurse said, hey, why don't we call Hazel? You guys consented for it. And we were able to see the student, assess what was going on, found that, she would benefit from having antibacterial drops or antibiotics. And we were able to get her, call in a prescription. She was able to pick it up, and she was back in school the next day, able to finish her exams. And, the mom just said, she was just so grateful. And especially because, she potentially would have to take time off work and take the student to, not an ideal situation for such a low acuity thing.
Beautiful. And then in walks our beloved COVID-19. The world went on topsy-turvy and everything in between, and we're still living through this. We thought we were close to ending this debacle, but it looks like we're still in the whirlwind. So how has Hazel changed, modified, pivoted, expanded, decreased, modified your model because of this pandemic? What has changed for you in terms of student entry, the kinds of students coming in, and what you're actually providing in terms of products and services?
It's a great question, Natalie. Let me just start off by saying, in the beginning of the pandemic, we pivoted, and it was something that we were always considering doing, but we started offering Hazel at home as well. So not only at school, but for at home, because many of us were in shelter in place. I live in California, and that's where we were definitely living. And in the beginning of the pandemic, I think a lot of the questions were more about, I'm not exactly sure. I'm nervous about COVID, and the students were not in school at the time. And then, quite honestly, as students are coming back, the conversations are shifting more towards, my student is sick. When can they return? When is it safe for them to return? And quite honestly, I think that the biggest change is just the increase in mental health conditions, and it is coming to us in kind of multiple different ways. It's always something that we have worked at in Hazel. Students come in with physical ailments, as I mentioned beforehand, and sometimes there's an underlying mental health struggle. And now we're seeing it with students, just the isolation, and really struggling with that. And sometimes it's just not being able to make that connection, and sometimes it's exacerbated as they've returned to school. And so increase in anxiety and depression. Sometimes there are new things that parents are not as familiar with, including suicidality and crisis situations. Sometimes they're older situations that maybe were addressed 3 or 4 years ago, but are coming back. And so parents are coming to us asking for just tools, resources, understanding what they should do, what is normal, and how they can help their student and their families.
So now that it's a lot of schooling has gone remote, a lot of states have gone that, there's variations across the globe, obviously, but how is the intervention happening now? Is it students who are joining asynchronously or synchronously with their teacher? How are the teachers leveraging technology, which is new for a lot of them, reading body language without seeing the full body, and ascertaining that something's actually wrong? Is this a situation where the referral base is declining because of that issue? Or do you feel that the opposite has happened, where there's increased visibility, where face-to-face, and teachers are able to delineate if something's wrong sooner and more effectively?
Natalie, it's a great question. I would say it's probably happening in both worlds. In our world, in general, I think our partners and mental health agencies in general, in the beginning of the pandemic, kind of demand decreased, and we knew that it was just pent up. And I really do feel like it is coming very strong now, and there is a lot more just awareness, and people are looking for it. I would say teachers are heroes. Many times they are coming through teacher referrals, working with counselors, working with their school nurses, and sometimes they're with parents as well. And quite honestly, we're also seeing it directly from the students, raising their hands saying, hey, I want someone to talk to, and let me just at least start the conversation and see where it goes from there.
Wow, that's incredible. And I'm sure you've seen an incredible uptick on that. And so you mentioned that very succinctly, Jeannie, around the mental health. We talk a lot about COVID having acted like an accelerant for change that was actually inevitable. It just basically sped it up. Would you suggest that mental health issues and conditions were always there and building up, but that COVID actually acted like an accelerant in the same way that it did for digital transformation? Is this something that we were inevitably going to see, this large bolus coming through?
I absolutely agree with that, Natalie, that mental health, struggles and conditions were always kind of there. It definitely have exacerbated them, just the pure isolation, and not having your supports. School districts, quite honestly, support their families in so many different ways. And not even just education, that's kind of like the base level, but, right when shelter in place happened, a lot of our districts were focusing on how do we get food to our families. Many of their students relied on the district for 3 meals a day. And so just like the basics, but also kind of all the other support systems that they have in place. So group therapy, their counselors, and so many other connections that they support. And so without that support, I think they were probably mental health issues kind of underlying it, but they definitely got exacerbated without that additional support.
I was just curious as well too. Probably some people actually say never waste a good crisis, but anyway, because there's a lot to learn from it. I'm just curious about what you are pontificating and predicting. If this is just one big giant psychological experiment that has happened, and if there's going to be reams and reams of clinical studies and reports, they're going to come out to show something. What is if you were to hazard a prediction on what this would look like or what's going to come from this, what would you say would be the future of this from a psychological standpoint?
Yeah, it's a good question. I would say, probably thinking about it, just the earlier detection of mental health, I think, is probably going to be much more pervasive. I think it's kind of seen much more at like the high school level. But I definitely think that from a elementary school and a middle school perspective, it will come out, it'll look different. But I definitely think it'll kind of, that will absolutely bubble up from a research perspective as well. And the next step would be, what do we do about it? And how can we have earlier interventions, and what can we do to make sure that the students are on the right path going forward?
Just curious if other partners, agencies, pharmaceutical companies, people who are looking for interventions to help, are they approaching Hazel Health to look at a cohort of potential students, patients to be part of advisory boards, focus groups, market research, or even potentially participants in clinical studies? Because again, getting to pediatrics and whatever is a very sensitive area in the pharmaceutical space. It requires all sorts of extra, ethics review boards and all sorts of other protocol management on these clinical studies. Is that something that Hazel Health is and will do?
Yeah, I mean, we've started some kind of, we've done more on the education side. So how can our impact help both from like a chronic absenteeism standpoint, from a DI standpoint, looking at our data, obviously in partnership with our school districts. And much more broadly, I think, Natalie, what you tapped on was, how can we as a community and a cohort be helping the communities that we serve? And so that can be everything from, mental health, pharmaceuticals, local PCPs, hospital systems, and how can we, really, really wrap around each and every student to make sure that they get the best care that they need.
One of the things I think is really outstanding about this is it's not as simple as it appears. A lot of times when we try to solve problems, we try to, things can look complex or complicated, and we try to tease each little individual thing, and we realize or forget that everything is kind of interrelated. And it takes a lot extra, persistence and in big, hairy, audacious thinking to get more into what we call innovations thinking. So systematic or systems thinking, integrative thinking. So looking at the very complex picture, looking at the flow of incentivization, where are people being incented to do what they're doing, and starting to tease that apart. So I'm wondering if we can linger on some of these key components of this. We talked a little bit about mental health, but delving further into this, I'm just curious, because I heard some stats today recently about suicide rates. There's actually some studies to support that in the real depths of the pandemic, that they actually found that the suicide rate had decreased. Is that actually true? Or was it just that people kind of froze in space, and then it's just the culmination is starting? And, is there an intuitive feeling that suicide is increasing and perhaps one of the causative factors is COVID-19?
Quite honestly, Natalie, I hadn't seen that study. However, just pontificating a bit, what we are seeing is absolutely an increase of students asking for help, saying that they're experiencing suicidality, feeling a sense of hopelessness, and really just not wanting to be there. The thing that I think families feel like are breaking their hearts even the most are feeling like wanting to make a connection, wanting to help, but not having the resources and able to do so. And so from our perspective, we are absolutely seeing an increase. However, I think in general, like going back to what we had talked about earlier about some of our mental health partners, right in the thick of COVID, their actual, referrals and, the demand had actually decreased, which was really surprising. But again, like waiting for kind of that bolus to really come through, and we knew it was going to, and I really do feel like it's coming now.
Interesting. One of the things I think also is a lot of students, children, people under the, considered not adults yet, have obviously had to resort to distance learning, virtual classrooms. If they weren't using technology in an exorbitant manner beforehand, they probably are now. Has curriculum changed, or how is Hazel Health helping to implement education around social media hygiene? And I'm just curious if you've noticed an increase or a change in the amount of cyberbullying, cybersecurity issues, and how kids are managing in this sometimes very scary virtual world.
It's a really interesting topic. I would say in general, like part of our connection is understanding bullying and how's that happening. We sometimes are speaking with students, for example, that would kind of have a headache or a stomach ache right before lunch, for example. And so bullying, I feel like is something that probably has happened forever. I definitely remember growing up and being around it, and it just looks very different. And so cyberbullying absolutely is coming in a very different way, in a highly connected society that we are at now. It's interesting. Some of the things that we have heard, quite honestly, is that there are students that are actually doing less screen time outside of school. And mainly it's just that they want the opportunity to shut it down, and they need to like get outside. And now that shelter in place orders are lifting, we absolutely are recommending that they get outside more, even just to avert their eyes and stretch and things like that. And so I think the fatigue is real. I have personally noticed for myself that some of our meetings that we actually stopped doing Zooms, and to say, hey, let's just connect in a different way.
Right. No, totally makes sense. Just sort of on this similar topic about other things that people are kind of arriving at in Hazel Health is what's really interesting, I think, about the present generation, and you hear all kinds of things about helicopter parents, but obviously the pandemic and everything else in between that's just confluenced into this big monstrosity is the question around what kids are doing around their sexuality. And there's a lot of data and books and pontifications and people sharing their opinions about this, but a lot of questions coming up recently, especially for young women, around gender dysmorphia. Who are they? What are they? What is their true sexuality? Is this something that Hazel Health has knowledge about, has healthcare providers in, and dealing with these particular subjects and topics?
We definitely have, providers that have deep experience working with students, especially at different age groups, and probably different questions that are happening there. From a perspective of, have we seen it very often? I would say probably not, in like the interactions that we've had so far. Not to say that it wouldn't happen, but it hasn't happened as of yet. And there's also complexities of working in school districts, and what we're able to connect with students on, especially around sexual health and identity.
Yeah, and I'm also just curious as well too, as in lockdown, people getting into basically kind of boredom phases is sometimes, like you said, a lot of things can come up, mental health issues, and sometimes that can, people who have proclivities for certain addictions, game playing, shopping, it could be online shopping, eating, drinking, and drugs. Are these things that you have seen increase? Is this something that you are actually actively studying? So there's actually statistics that you're drawing from your audience and or from the people that you work with. So what have you seen surface recently?
Yeah, absolutely. We have definitely seen it from a perspective of, I think it is tied in to the mental health conversations that we're having, and having additional connections that are outside just being at home. And we have seen it arisen from screen time, game playing, and connecting basically through Fortnite and other kind of social gaming as well, and also things like sleeping. Really struggling to get up in the morning. Sometimes that is because gaming is happening at night as well, and so absolutely have seen it from a lot of different angles.
Do you and how are you actually leveraging this technological generation that we're in? There's obviously a lot of detriments. Some of the concerns, of course, is how are people learning to relate to each other, that there might be some dysfunction there. But looking at the positive side, are you seeing other things rounding up as a result of this entrenchment in the digital?
Yeah, absolutely, Natalie. I mean, I have to say, in general, many of the students that we pop in on, and we're doing a visit, they are very natural, and they connect very, very easily, because they've been doing things like Zoom, and they've been connecting potentially with grandparents or teachers, obviously, through this platform, and so it is like almost an immediate connection. I think much more broadly, in terms of what we had been talking about telehealth as a platform, we've heard that not only is it helpful for the student, but it's also helpful for parents. So parents on average can save about, with our families that we work with, about 5 hours of time. And that could mean not having to take time off work, which could potentially be the difference of, we've had families say, gosh, if I had to go, I can think of like one parent in particular, and she has 3 kids. And so she says that she dreads getting that phone call of like, you need to pick up your student, because she says she needs to just pick up all 3. Because, she's not going to be able to come back and get the student later. And that's a $20 bus ride and 6 hours that their whole family is sitting there. And so she's like, I immediately do the math and I think about, what am I going to drop from my grocery list? And so it is a real kind of issue at hand that we can help with. And so I think telehealth is definitely something that in certain situations can absolutely help. And we've also heard teletherapy as well. So just students just feeling much more comfortable being in their home environment. And therapists can get a better sense of their family structure, what's going on in the room, which I'm not going to show you my room, but that is influencing their reactions.
What does Hazel Health do in situations that we're hearing a lot more of lack of safety in the home? There could be spousal abuse, there could be children abuse and other sorts of things. There, like you were saying earlier, a lack of sustenance and food and other things. What does Hazel Health do in those particular situations?
Yeah, I think this is where the beauty of having a really strong partnership with the school is really helpful, and other connections in the community as well. And so when we partner with the school district, we understand like what other resources are available within the community. And so absolutely work with the family to understand where are the gaps, what are the barriers, and we have a whole care coordination team that works with the family to get them what they need. In terms of what you had mentioned earlier about if we feel like there is neglect or, if there's a need for like child protective services, we do get a glimpse of what is happening into the home. And so we are mandatory reporters. We take that absolutely seriously. And we do take that next step if it is necessary. And working with the family to do whatever is in the best interest of the student.
We obviously you're doing a lot of great and important work with different communities, underserved populations, probably really big on inclusion. Tell us a little bit about the diversity of the people that Hazel Health really focuses on. Is it leaning much more towards the underserved? What are sort of the overserved doing? Do they just not even bother with Hazel Health, and maybe explain the reasons why? Because I think at the end of the day, the question comes down to access.
Yeah.
Some of the really underprivileged don't even have cell phone coverage, or it's spotty, or they weren't able to pay the bill, or whatever else that's happening. So they just can't do their telehealth session and it gets canceled. I'm just curious about the populations. How do you do inclusion? And these people that are on the periphery, why are they not coming into the fold?
Oh, good, Natalie. It's a really great question. And I think that the importance of trust and the really working with the community as a whole. So to answer your question, we generally, the school districts that are like generally the most excited about Hazel are for the underserved communities. Many times it is, going into a medical desert where there is not a hospital or an urgent care or PCPs in their school district, or even within 20 miles of their school district. And so really wanting us to help fill that gap and provide additional access. And so many times this seems really serious. I'm not exactly sure what to do. Like, do they need to go to the emergency room, or do they need to go somewhere else? And so we can help navigate that as well. For students that do have a medical home and do have other avenues, there are definitely ways that we can help as well. Quite honestly, if someone called and said, "Hey, your son is not feeling well," I would love for them to talk to a medical health professional, a doctor, to say, yeah, they're okay. They're okay to stay in school, or you should really pick them up and get them to an emergency room as soon as possible. And we can definitely help both.
So I'm assuming that you partner with lots of different people that can, send out materials or supplies or send an ambulance, or so is this really more based on partnerships?
Yeah, we absolutely believe in working within the community and creating partnerships within the community, and being a part of it as well. And so, there are definitely times that we've spoken with the nurses or the families and said, like, we need to call 911, and we can help them do that as well if needed.
You brought up a really important point, in fact, a very important word, and that was trust. Children, I think, especially during this pandemic, a lot of their trust has probably been greatly diminished. I think that a lot of things that they've been hearing in the news, and quite frankly, you probably just getting this osmotically from your parents and other sorts of people, listening to the various vaccines working and not working and causing blood clots, and do I get it or not? They're in and out of schools. Nobody knows what's doing. Is it safe to wear a mask? Should I not be wearing a mask? Is it politically incorrect? Where do kids get their single point of truth?
My goodness. I would say I hope that every single student has someone that they can trust. That is generally a question that we do ask, especially if they bring up something. We always ask, hey, like, is there someone that you feel safe with, that you can trust and you can have that conversation with? And I think for each student, it's going to be different. That attachment figure, and so the trust that we build with the families really does start with the school, because they've established a trust with the family already, and they lend that to us and extend that to us. And so it's something that we take really seriously, and it's earned. And so each family that we work with, we have to earn that trust, and we work really hard to make sure it's maintained.
Yeah, absolutely. And trust in a lot of different things, including the vehicles and the tools that we're giving these children, these patients, these pediatrics, everything from wearable technology to what they're an app on their phone. There sometimes is a lot of resistance, especially because unfortunately, children are really susceptible to conspiracy theories. Even though they may not be aware of it, they can start following these threads and be dragged into a direction where they're very impressionable.
Mm.
So we're in this place where there could be concerns about surveillance, and I shouldn't trust this. And, Hazel is just trying to embed some silicon diode into my brain, and, 5G is going to, whatever, right? These crazy things are out there. What what does Hazel do in this scenario where there is this distrust of the tools and the services and just in general?
Yeah. I think just going back to the partnership with our school districts, and being in the community, helps and goes such a long way. And quite honestly, I think what has been most effective, if I'm being totally honest, is having the first visit, and working with a family and knowing that we absolutely have their students' best interests at heart, and we'll do whatever we can to make sure that they get the care that they deserve, and having that kind of filter out. And so sometimes that is a parent saying, hey, I just had an amazing experience with Hazel, and letting that kind of stand on its own. And just working really closely with the school district themselves, sometimes quite honestly seeing a face, like this, even of, hey, we're real people, we really do care. So sometimes our providers will meet with families, or with the teachers themselves. I actually do feel like the connection with the teachers and the families is so strong as well. Sometimes the families will ask the teachers, what is this? Is this something that we should do? And so ensuring that the teachers understand the benefits and the value that we can bring as well.
No, it totally makes sense. Um, so on that note, I'm also just curious about interoperability. A lot of times when we're building habits, like doing a telemedicine session, doing something that's kind of out in the ordinary and is not really something that we do on a regular basis, or refer to, Hazel Health, and just a lot of times if things are not part of your daily practice, I always refer to various books on that, or your workflow, it just doesn't become a natural thing, and it doesn't something that you will forget or you won't really remember something you should be doing or referring to, what have you. What has Hazel Health done to create a bit of that positive dopamine drip to get people intrigued, enticed, and want to be participating as part of this ecosystem?
Yeah, I would say it's evolved in the COVID world. I would say pre-COVID, we really worked closely with the school right when we would start with the school, and we would get anywhere between 70-80% enrollment. And so the real initial connection point was that first connection point. And then when their student's not feeling well, they go to the health office. They've already enrolled, and that's part of that experience as well. So working with the nurses themselves, so they can understand, oh, like for a family, we probably would see a family maybe once a year, but the nurses are doing multiple visits a day, and they're seeing multiple students a day. And so ensuring that it is a very easy flow for the school nurses and the initiators as well. When they're at home, going to your point of how do we stay top of mind? And we have an amazing team that is, staying connected kind of through social media, talking about, certain families that had worked with us beforehand, and keeping, it's like, oh yeah, actually that happened to my child. They got this, this rash or this bug bite, and just having common things to make connections with, of saying, oh, okay, yeah, that happened to my son, and I'd love to call Hazel to get their opinion.
Yeah, and it's a great opportunity to normalize things, because that always makes things feel more comfortable. You mentioned a lot about one of the leading competitive factors, or the differentiating factors for Hazel Health, is the human element, the nurse, the real human face, the real person. There are studies out there, however, that have showcased that sometimes, especially when it comes to mental health issues, that some people have preferred using the electronic recipient, the chat bot. You've probably heard of Wobot, a lot of other sort of electronic, cognitive behavioral therapy types of apps, etc. There's actually even a really cool one now. I'm sure there's many others, Replica, where people become friends with kind of a robot, which is basically a machine algorithm. How does that come into play with what Hazel Health is really differentiating as being the human piece? Is there something electronic that you are leveraging at the same time?
Yeah, I think there's always beauty in balance. And I think we believe that the human connection is absolutely important. And there are absolute times that having like a more digital avenue is something that we are also exploring, either through partnerships and or things that we're innovating on our end as well, to say, in between those human connection sessions, is there an avenue that someone can reach out and get answers, or just have an outlet? I actually have heard that same thing, that sometimes there's questions that can be associated with shame, for example, and that they don't want to voice that to someone that we've made a connection with, even if the trust has been established. And so it feels safer to do it in a more digital capacity.
Some people may want to ask this question of, how does Hazel measure itself? So you're considered an intervention in society and the community. So there's obviously no intervention, which is just the way people are dealing with healthcare, their outcomes, et cetera, with no intervention. And then comes Hazel Health and the positive things that you do. What are some of the metrics that you would actually go to if you were to sell this to another school district, of the kinds of positive outcomes that you help to ensue?
Yeah, it's a great question. I think going back to the student and what's in the best interest of the student, on average, each of our students after a visit will save 3 hours of instructional hours. And so that means, feeling healthy, getting back to class safely, and being ready to learn. And we've also seen really positive impact, anywhere between 25 to 40% reduction in something called chronic absenteeism. And so those are for students that miss more than 10% of the school year, and have shown that those students really struggle just long term. So they're behind in math and reading comprehension by third grade. The dropout rates are higher, multiple kind of different avenues, and having something like Hazel to intervene has also seen a reduction in chronic absenteeism. And then I think the other thing, quite honestly, we go back on is just our kind of net promoter scores. They're over kind of 95 with our families, and over 80 with our initiators, and just making sure that we're really being good partners and we're solving the issues that they are trying to solve.
I love the work that Hazel Health is doing, and I think you're doing a tremendous job there, Jeannie, with you and your team. Amazing things that you're doing for the underprivileged and underserved. I think there's great hope and exciting things in the future for telemedicine and virtual care in the post-COVID world. And Hazel Health is going to be a great contributor to that. So I think we're just kind of topping the top of the hour here. So probably a good time to sort of end on a positive note with all the great things that you're doing. For anybody who's interested in connecting with Jeannie, school districts, pharmaceutical companies for focus groups, clinical trials, or just some market research, we will be leaving Jeannie's contact details in the show notes when this becomes available. So please be on the lookout for that. We also encourage you to check out impetusdigital.com. If you enjoyed this conversation, if you're somebody who is looking to create change, you want to get some healthcare stakeholders around a virtual table with a series of touch points to collaborate, connect, share, build ideas, and start to do some of that systems innovation thinking. Impetus can help you with all of that through our asynchronous and synchronous virtual collaboration tools and platforms. We'd love to have a conversation with you if you're interested. So please like and subscribe. We would love if you could leave us a review on our podcast. We want to thank all of you. Jeannie, it has been a fabulous conversation. Thank you so much. And we're wishing all of you a fantastic day ahead.